Diaper rash is extremely, extremely common. This is caused by your baby's skin being covered constantly by a diaper, and that means that it's very moist and warm in those areas of skin. So to see some redness is really expected, and in fact, almost every baby who wears diapers at one point or another will have a diaper rash. There are many causes of diaper rash. The most common cause is just the prolonged contact of your baby's skin with moisture, with urine, with feces. And those contain enzymes that break down the skin, and that's why it becomes red and sometimes raw. There's also something called chafing dermatitis, and this just means the skin rubbing against the diaper and that rough friction causes a red rash. This kind of rash really tends to come and go quite quickly, and usually you won't need to worry about treating it. There's also a type of diaper rash that's a sign of infection, and the most common type is called a yeast infection or a Candida diaper rash. And this is from yeast that's normally found in your baby's intestines and sometimes go onto the skin and cause a rash. And you'll know that this is present because you'll see a red rash, and then around it you'll see little red bumps or pus bumps. And if you see that, you really want to call your pediatrician or call us because we can treat that with a topical antifungal cream. So let's talk about a few things that you can do to try to minimize diaper rash. The first part you're probably already doing is to make sure the diaper is changed quite frequently. This is important not just for you, but if there's other caregivers, grandparents, babysitter, make sure they understand that as soon as possible after the diaper's been wet, they need to try to change it. If it seems like he's really prone to developing diaper rash, then you can also think about using some topical products. So some ointments like zinc oxide or petroleum jelly-based ointments that you can apply after every diaper change, and that will really form a little barrier on the skin so that he has less contact with urine and feces. Because remember that urine and feces contain a lot of enzymes that can really break down the skin and cause diaper rash. So remember, diaper rash is extremely common, and almost all babies who wear diapers will get it at one point or another. Most cases are going to be the real common form of diaper dermatitis or diaper rash, irritant diaper rash, and that's caused by contact of the skin with moisture and heat, and you can really help prevent that with frequent diaper changes, use of super absorbent disposable diapers, and application of a topical cream or an ointment that can help protect the skin. Things you should worry about would include blisters, pus bumps, red bumps, or open sores, and any of those should encourage you to call your pediatrician. And again, diaper rash is extremely common, but if you ever really have a concern or you feel it's more severe and isn't responding to your treatments at home, then don't ever hesitate to call your pediatrician's office.